Recording as we speak.
Awesome.
Do you want to go ahead and get started, or you still want to wait a couple minutes?
I think we can go ahead.
Oh, okay. Well, as you said that, a couple more people joined.
Well, more folks have showed up. Excellent.
Hi, Stacy.
Good morning.
Good morning. Okay, we're going to go ahead and get started. Okay, Raider says he can't hear. Can everybody else hear me okay?
I can hear you.
Yes.
Yes.
Okay. Maybe Raider could either join somebody else or somebody could help him get the speaker going.
I figured it out. Thank you.
Oh, okay. You're good. Thanks. Okay. Let's go ahead and get rolling here. Today, we're going to dig down into the heart of the VMSG dashboard, which is operational planning. We're going to walk through all the different levels of the pyramid we've discussed. We're going to look at real live examples from public health at each level. So it hopefully helps you to get your head around, what does each thing look like in the system here. Then at the end, we're actually going to go in and enter an operational plan in the system. We're going to use the same example of tobacco cessation. And then this is the only session that we will be assigning homework. And the homework will be that you guys actually go out and create a very simple little operational plan in the training group. And then our next session, we're actually going to go review those plans. So the idea is after today, you should be able to go in and just create a very simple operational plan, understanding what each different level of the pyramid looks like and such. So let's go ahead and get started here. So remember the pyramid model. The organization is your health department. Groups is the basic structure of your health department. So divisions, offices, programs, plus any of the highest level plans like the ones you see in the bubbles up there, the Fab 6-pack of plans are typically independent groups. Each group has its own set of services or initiatives. Services are ongoing things. Use the example of WIC being an ongoing service. Initiatives are future programs that you're trying to roll out, that you're planning for. Each service or initiative has a set of high-level goals. Each high-level goal, a set of SMART objectives. Each SMART objective, a set of activities. Now, the first thing I want to talk about is the nomenclature. This is probably the most common nomenclature for operational planning. However, it is not cast in concrete. You'll see operational plans that people move these names around and provide different names for different levels in here. I'm going to walk through some of the examples we've seen over time in public health. And the reason I want you to kind of understand that is because the model still stays the same. The pyramid model still fits, but the names might change. So somebody could come up to you and say, here's our new community health improvement plan, put it in the system. And you look at the names on the levels and they're different. You'll be able to decipher that after today, I hope. So let's look at some of those examples here. So here's one. Strategic priorities at what we call services or initiatives, goals, strategies as opposed to objectives. I don't care for that one personally. I think strategies are more of a way to get there and the objective is where we're trying to get to. And then objectives. So in this case, if we flipped strategies and objectives, I think it would be better. Strategic priorities is very typical for your strategic plan, obviously. Strategic areas, still a pretty good definition of services or initiatives. Goals, outcome objective, kind of like that one because the objective is what outcome are we trying to achieve. And then strategies, it's okay there, trying to get to the objectives. Priorities, goals, objectives, and action steps is a real good one. Action steps is probably the most common term we see for activities. Priority areas, goals, strategies, and action steps. Again, strategies I don't care for. Priorities, goals, objectives, and strategies, that's okay. This one's interesting. Strategies at the top. And then strategic objectives, which is not bad. It's a higher level than an objective for the goal. Objectives and action steps. So again, somebody hands you a plan. It's got different nomenclature. After today, understanding what each nomenclature looks like, I think it'll help. So let's talk about groups. Again, groups is primarily the structure of your health department plus the high-level plans. Groups are indicated by levels. So level 1 is your top level group, typically your department. Level 2s all report to level 1, level 3s to level 2, et cetera. So it's the hierarchy. Levels can go up to 10 deep. Nobody's ever gotten that deep, but it's possible if you wanted to. let's say we have a community health division that reports to the department. So the community health division has what we call a parent group called department and a level 2, which is one level below the department. And let's assume in this little operation here that WIC reports to community health, which reports to the department. Now, if you are an org admin level user, the highest level user, you can move these groups around real easily. So again, I mentioned there's a parent group drop down. So I could say if I wanted to move WIC up under the department versus under community health, I would just take the parent group drop down and change it from community health to department. And then I would change the level from a level 3 to a level 2, and it would become, WIC would become at the same level as community health and under the department. Your strategic plan is typically a group within itself. Typically, it's a level 2 group reporting to the department. Same thing with your community health improvement plan, typically a level 2 reporting at the department. And then today we're going to use the same example we've been using, tobacco programs, in this case, Tobacco 2025. Let's talk about services or initiatives. This is just some examples of the high level. I call these buckets or containers. So we're going to have a set of plans, in this case, that will get us to healthy moms and babies. Healthy moms and babies is really not part of the plan itself, but it's a container for the plans. Here's some examples. Readiness for emerging health threats. Effective agency processes. Access to care. Behavioral health and substance abuse. Population health. Organizational excellence, chronic disease prevention and control, health disparities, and today we'll use the example of tobacco cessation again. So again, if you look at these, this is just a container for a set of plans that are going to get us to whatever we're trying to accomplish here. The beginning of the plan itself is typically the high-level goal. High-level goals are typically fairly simplistic, typically an action verb followed by a few words like reduce the risk of infectious disease, promote safe and sanitary food establishments, support communities in building resiliency, enhance healthcare through technology, drive health and all policy agendas, reduce the risk of vaccine preventable diseases, promote public health readiness and response, promote succession planning and career growth, integrate a data-driven best practices approach, reduce smoking in high schools. So again, this is a pretty high level. However, it should be kind of self-explanatory. If I say we're going to reduce smoking in high schools, that makes perfect sense to everybody. What it doesn't tell you at this point in time is where are we going to start? Which high schools? How much do we think we can reduce smoking? By when are we planning on doing this? So that's the goal, encompasses all of that. But when we get down to the SMART objectives, that's where we get down to that level of detail we're talking about. Our nomenclature is pretty simple: specific, measurable, attainable, realistic, and time-based. If it's not attainable or not realistic, don't waste your time. So focus on specific, measurable, and time-based. And for each of these examples I show you, kind of try to pick out those three things. By December 2024, identify 2 or more strategies to collaboratively reduce risky alcohol-related behaviors. So in this case, the specific is strategies to collaboratively reduce risky alcohol-related behaviors. Our measurement is 2 or more, and our timeline is by December 2024. By December 2024, 80% of educators and school staff have been exposed to ACE awareness education. By June of 2024, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, all programs will have established goals, objectives, and activities to be reported on in the VMSG dashboard. And then again, we're going to use the example of reduce smoking at Wayne High School by 25% by the end of the school year. So the objective is a target. This is exactly what we're trying to accomplish. And again, if I tell you we're going to reduce smoking at Wayne High School by 25% by the end of the school year, we all understand what we're trying to accomplish. What we don't know at this point in time is how are we going to get there? And that's where the activities come in. And as we talked about earlier, there's 3 types of activities in the system: project-based activity, quality assurance activity, quantitative measurement activity. I got an example of each of them we'll kind of go through. And when I enter this plan into the system, I'll go through the real detail on these. So our project-based activity: create training content and materials for students and faculty on the dangers of smoking. So this is a project. It's going to be to create PowerPoints. It's going to be to create user guides. It's going to be able to create video content, whatever we can do to create the materials. How do we know when we've gotten to that particular activity? That's what the performance measure is about. How do we know when we successfully completed the activity? Once the training content material has been created, we've completed the activity. When are we planning on doing this? So we're going to have a beginning and ending date, in this case, April 1 through May 31st. We're going to assign team members and team leads. If we have external partners involved, we're going to assign them. Our measurement is real simple in this case: percent complete. How far along are we in creating the training content? So that's our project-based. And by the way, the project-based activity is the most common. It's been around for the longest. And this is the only one where you manually create the performance measure. And usually that's simple. If we're going to create training content, we'll be done with the activity once we've created the training content. Our second type of activity we're going to talk about is the quality assurance activity. Provide 9 training sessions each month on the dangers of smoking to students and faculty. QA activity is used when you have something that's repetitive and you're going to use the information in the activity itself to set the traffic light. So in this particular case, our repetition is on a monthly cycle. And I'll show you in a few minutes that you can select we call a frequency, anywhere between weekly and every 5 years. And in this case, we're trying to get to 9 training sessions. So if we get to that 9 training sessions or more, we're going to say the light will turn green. And then we're going to pick some number that we say is not good enough. And we're going to say, if we only get to 6 or less, the light's going to be red, which leaves 7 or 8 in there as yellow. Instead of a beginning and ending date, we set a cycle start date. So the cycle is that frequency, in this case, monthly. So if I set the cycle start date to May 1, 24, and the frequency to monthly, then the end of May will be the end of our calculated end date in there, and it'll move forward every month. Our performance measure will be somewhat created for you. I'll show you how that happens. Training sessions provided, measured monthly, and our green, yellow, and red values. We're going to do team assignments, external partner assignments, and our measurement, as you can imagine, is how many training sessions do we do. So that's the QA activity. By the way, the least used type of activity, just because it's very specific to being repetitive and automatically setting the traffic light. Quantitative measurement activity. Contact all 20 tobacco vendors within 1 mile of Wayne High School to assure they're not selling to minors. You're going to use this anytime you have something to count. You're going to count the number of vaccinations. You're going to count the number of medications distributed. You're going to count the number of car seats installed, the number of tobacco vendors contacted. So it just helps you to calculate how far along are we in here. So in this case, it's the only real difference between this and a project-based activity is the target quantity. In this case, our target quantity is 20. So if in fact we did 20 contacts with tobacco vendors, it's going to calculate to be 100% complete. If we'd only done 10 contacts, it's going to say that we're 50% done. We got beginning and ending dates, just like we do in the project-based activity. Our performance measure, again, will be somewhat created for you. 20 tobacco vendors contacted between May 1, 24 and June 30th, 24. And we're going to do team and partner assignments. And as you can imagine, our measurement is pretty simple. How many tobacco vendors did we contact? So those are the 3 activities and the 3 types of activities. Again, project-based will be used, 85, 90% of the time. Quantitative measurement will be used in the same place a project-based activity, but you're actually having something to count. And then the QA activity will be around if you're doing something cyclical, like 9 training sessions a month or X number of things on a quarter, something along that line. So if everything that was at the bottom of each of these slides, the blue for the tobacco program, and put them together into a plan in a kind of a bullet format, it looks like this. Our group was tobacco programs for 2024. Our initiative was tobacco cessation. The goal we selected was reduce smoking in high schools. Our objective is to reduce smoking at Wayne High School by 25% by the end of the school year. And then the steps we're going to go through to get there. Create training content, provide training sessions, contact the tobacco vendors. So this is a segment of a plan. Plans can repeat at any level. You can have groups and subgroups. So you might have a subgroup for a different kind of a tobacco program, maybe a vaping program or something like that. And then you're going to build a plan underneath that. In this particular case, we're going to repeat at the goal level. So we have reduce smoking in high schools. Our next goal might be reduce smoking in colleges. And then underneath that, we're going to have another plan segment like reduce smoking at Wright State University by 25% by the end of the school year. And then as you can imagine under that, you'd have a similar set of activities to get there. So that is the planning process in here and the different levels. Now, attached to the meeting invitation you have is a blank version of this template. Well, not really blank, but without the actual plan in it here. This is an operational planning template that was created by one of our clients up in Wisconsin. And they did it so they could have an offline way to create a plan, pass it around to their peers, get everybody's input before they put it in the system here. So we're going to use this today to actually input this plan into the system. But let's talk about the template.
Fred, I'm not seeing that template in the invite.
Okay, well, I'll make sure I send it to you. I'm sorry about that.
No, that's all right. Thank you so much. I appreciate it.
I have been known to forget things like that before and everything else I did today. So, okay. The service initiative, nice thing about the template is it kind of gives you a quick reminder of what each level is. So for service initiative, it says, what bucket of work or priority does this relate to? Pretty good definition. In this case, tobacco cessation. Our first goal, what is your pie in the sky or high level goal? Reduce smoking in high schools. And we get down to our SMART objectives. Specifically, what and when do you hope to accomplish? Our objective leads is who's going to lead the charge, who's the person. The activities, what are the steps you will do to accomplish the objective? A performance metric for the activities, how will I know when I've successfully completed the activity? The activity leads, who is primarily responsible to do and update this activity, and our activity leads, and then we're going to have the dates in here. So let me take you to the actual document itself. Here it is. And again, I will send a copy of this out to you guys. So this is the operational plan template. So what I'm going to do is actually enter this plan into the training group on your system here. So I'm going to highlight tobacco cessation. It's a Word document, by the way, so you can right-click copy or whatever. I like keyboard shortcuts. So Control C is copy. So I copied that. I'm going to go back to our plan here. I'm going to go down to under a training group, we have Tobacco 2025. I'm going to go to my services or initiatives. So by selecting Tobacco 2025, I'm building the plan under the Tobacco 2025 group. I can either click on this big plus button here, which basically blocks you from entering anything until you open up a record, or this plus button here. Either one is the same. Click there, and I'm going to hit Control V for Victor, which is paste. So tobacco cessation. The service or initiative is determined just by this checkbox. So if it's unchecked, it's a service. If it's checked, it's an initiative. Doesn't make a whole lot of difference. The reports will say initiative versus service. The VMSG public website will have initiative versus service. The dates on the activities are typically future dates versus current dates. So that's kind of the difference between a service and initiative. We'll go ahead and save that. So now, oops, I missed the N. I just put the N in there and save it. Okay, now let's assume that this was Tobacco Cessation 2024 and we've completed the program. If I wanted to archive that, all I got to do is hit this hide service checkbox down here and save it. And you'll notice it grays out up there. What that means is that normal users can no longer see it. Manager and org admin users can see it. They can report on it, that sort of thing. But it's basically archived. So it's just a way to keep historical data in there. We'll go ahead and uncheck that, save it. So we have tobacco cessation as our initiative. Let's go back down here now and grab our first goal, reduce smoking in high school. Control C to copy, go back over to here. Hit this time, I'm going to go down to the goals tab. So by selecting tobacco cessation, selecting the goals tab, it's going to take me to the goals specifically for tobacco cessation. And again, I'll open up the record. Control V, reduce smoking in high schools. Go ahead and save that. At this point in time, I can determine whether I'm going to change the traffic light or not. Two ways you can do that. I can either cycle through them with my mouse, so gold, red, yellow, green, or I can just use the drop down. Either way is fine. Some people like it one way, some people like it the other, so we gave them both choices in here. I'm going to go ahead and save this to green. Now, typically, if it's an initiative, it's a new program that you're rolling out. So you haven't really had time to get behind schedule. So typically, it's going to be green, going to be on schedule in here. I'll go ahead and save that. So we have our high-level goal here. Let's go ahead and add another goal to it. So we got reduce smoking in colleges. Control C. I'm going to hit the plus button this time. Control V, reduce smoking in colleges, save that. Go back and grab the third one, reduce smoking in public areas. Control C. Again, hit the plus button, Control V, and save it. Just kind of an FYI. Everything that you see up here in the top is actually coming from the server. Everything down here in the blue in the bottom is on your local computer until you hit the plus button. The reason for that is because you can be working, doing a lot of stuff down here, a lot of data input, and you don't need to be going back and forth to the server. And what it does is make it a very efficient way to do multi-user computing. So everything I'm doing down here is local. When I hit that button, it takes a fraction of a millisecond to send it up to the server. So it allows you to have, literally, we have 6,400 users on the system. So everybody has full access to everything in there. Now, to get to the objectives for reduce smoking in high school, I can do one of two things. I can either click on reduce smoking in high school up here, hit the objectives tab, or we have what we call drill down arrows over here. Drill down arrows, if I hit this one up here at the top, it's going to first select reduce smoking in high school and then take me to the next tab down. Saves you one mouse click is all. But if you got a bunch of these on here, sometimes it's simpler to do that. So I'm going to do that. Now I'm down at my objectives. I'll go ahead and open up the bottom here. Let's go back and grab our objective for the first goal here. Back up to the top. Our objective here, reduce smoking at Wayne High School. Oops. Control C, go back over to here. Going to add it on here, Control V. Go ahead and save that. So, reducing smoking at Wayne High School. The next thing I'm going to want to do is say we're reducing by 25%. The default for an objective is percent complete, 0 to 100%, which is down here. It says objective percent done. In this case, it'd be 0 to 100. I can change that. I'm going to click on the title here, and it's going to say, in this case, instead of percent done, I want to say percent reduction. The measurement units here is just what appears after the field. So you see the percent sign. That's all it is. It's just giving you a little bit more definition here. I can choose decimal or percent. Decimal would be if you're counting anything. So you're counting vaccinations or whatever it happens to be in here. You choose decimal, and then it becomes non-percent, basically. Anything else would be percent. I'm going to go ahead and select percent. So now we're sitting down here and say we're at percent reduction, 0%. I'm going to go ahead and put that at, say, 20% for now. And I'll go ahead and save that. Now, anytime I make a change down here to the objectives or activities, it's going to give me this little dialogue. Is the traffic light correct? There's only a few things that automatically set the traffic light. So the project-based activity we talked about, when you take it to 100%, sets it to gold. And the QA activity, you determine what sets the traffic light to green, yellow, and red. But in most cases, you're going to set the traffic light based on the information that's in the system plus any information you have outside of that. Is the traffic light set correctly? I'm going to go ahead and say, yeah, it's fine for now. Okay, now anytime, well, the next thing we're going to do is assign a person here, so the objective lead. To do that, I'm going to click on this little down arrow here. Now, the reason nobody shows up in here is because we're within the Tobacco 2025 group, which is a training group, and nobody's assigned to the group. So I'm just going to go ahead and say show all users. So I'm going to go ahead and just pick Ginger as our user up here. So Ginger is now the objective lead. Two responsibilities, basically. She's going to be the project manager to get us to this reduction, and she's going to be the person to update the status here, typically, again, through the real-time planning email notification. So Ginger, you're going to be doing the updates every time you get that email. I'll go ahead and save that. Now you'll see that our current status is 20%. Ginger is our objective lead up here at the top. Anytime Ginger makes a change to anything over here, so the percent, the traffic light, the actual objective itself, she might want to put a note in here. Two ways you can do that. You can just click on here and start typing, Or if you wanted to put a time and date stamp on there, you can click this little button right here. Puts a date, a time, and in this case, it would normally say Fred Erickson, but I'm on a different login here. So I'm going to go in and say, oops, 20%. And if you were to set the light to yellow, you might put a note in here, set light to yellow because of this, something like that. And the idea behind that is that other people are going to be looking at this. And if Ginger went ahead and made changes on here and didn't put a note in there, and somebody says, I wonder why that traffic light is yellow, and they don't have an idea, put a note in there, just let them know. That way you're reducing the need for them to call you and say, hey, Ginger, why'd you change this light to yellow? Down here at the bottom, we can put in a data source. So where am I going to go to get the current information? Let's say that we can get this from the CDC Smoking Cessation Fast Facts webpage. So to get that data source in there, I click on here, and I'm going to type in the description. Now, when you put in the link, you can put in something on your intranet. You can put something on the internet. You can put it on your file servers. Pretty much any place you can go to get a link, you can do that. So you got to define where the link is coming from. So I'm going to put this to the CDC website. I don't have the whole link for the smoking cessation. There is one, but it's a long link here. I'm just going to put the CDC website. So I'm going to start out with http://. If it was a secure website, it'd be HTTPS. It could be an FTP site. It could be lots of things. So if it's going to be on your intranet, talk to your IT folks. They'll give you the link that you need here. www.cdc.gov. And then I'm going to hit OK. And I'll go ahead and save this. So now down here you see the definition, CDC Smoking Cessation Fast Facts webpage, and this little link button shows up. When I click on that link button, it opens a new browser tab and takes you, in this case, to the CDC website here. You can put, again, any kind of a link you want to put in there. But if you do have a place that gives you the information you need to update the status of a goal or an objective or an activity, you have this field on all of those screens in there. So you can put that in there. It just gives you the link that you need to be able to do the updates on there. So that is our SMART objective here. Now, the next thing we're going to do is enter the 3 types of activities here, and we're going to go into kind of detail on doing that. So my first activity is that project-based activity, create training content, Control-C, go back over here. I'm going to go down to my activities, open it up. I'm going to paste it in there, Control-V. In this case, it is a project-based activity, so you can select the type here. We'll leave it as project-based. That means because it's project-based, I have to come up with a performance metric. Let's go back to here, and I just happen to have one. Training content material has been created, Control-C, paste it in here, Control-V. We're going to put in a beginning and ending date. So I'm going to go ahead and say March 1st through March 31st in here. Now, just kind of an FYI, you have to have at least an ending date in an activity. If it does not have an ending date, it thinks it's not an activity. It doesn't show up on the report. So at least put in an ending date. Should typically have a beginning and ending date. If you have a beginning and ending date, then it can calculate your percent complete. If you just have an ending date, it has no beginning date, so it can't really calculate that for you in here. I'm going to go ahead and save this. So this is my basic activity. Create the training content materials for students and faculty on the dangers of smoking. I'll know that I've completed that when the training content material has been created. I'm planning on doing it in the month of March here. I've got my current status over here. How far along are we in doing that? So before I do that, I'm going to go ahead and assign a set of team members and a team lead. So I'm going to click on this guy. And again, we're in the tobacco group, so nobody shows up. To clear the filters up here, the group filter, I click on any one of these little black X's. What that does is clear it. So let's go ahead and we'll pick Amy as our lead. So when I click on lead, it automatically sets them as a team member and by default makes them the email recipient. So Amy is going to get that real-time planning email on a regular basis to go back in and update this particular activity. And then we'll choose Carolyn and Aaron as team members on here. So the team members are exactly that. They're the folks who are actually creating the training content. and Amy is leading the team here. I'll save that. And you'll notice down here we have Amy with an L for lead. The blue around the L indicates email notification. And we have Carolyn as a team member and Aaron as a team member down here. The other thing we would do, and I'm pretty sure you guys don't have any external partners in there yet, is to add external partners. So I'll click on this button here, and yeah, the left side would be partner organizations. So in this case, it might be VMSG Dashboard as a partner organization. For every partner organization, you can have an unlimited number of contacts. So you can have the contact, the name, email, all that kind of stuff in there. So I can assign as many partners as I want and as many contacts for each partner as I want. And they'll show up down in that bottom left down there. So
Fred,
yes.
do they also have to have licenses in order to access this, to view it?
If they're a partner, yes, they would have to have a license. But to be a partner in the to be selected as a partner for an activity, they don't have to have a license. They're just it's a designation that they're a partner and they're not getting access.
Great.
If you want them to have access, then yeah, we need to have a user license.
Great. Thank you.
Okay. So that is pretty much everything on this particular activity. This is the activity wizard. Each type of activity has its own little wizard. So if I click on this one, it says our start date and our end date in here. You'll notice that my measurement is a percent complete. So 0 to 100%. So if I were to say that we are at 100% complete and I click off of it, you'll notice it sets the traffic light to gold. Now, it doesn't necessarily mean you're done with this. It could be that you're just done with it for now, and you might want to set this back to green. So you can override the gold if you wanted to with a green at that point in time. So when I save it up here, is the traffic light set correctly? I'm going to say, yeah, it is. And it moves the traffic light to gold up here. Now, you got a couple other options. If I were going to be doing this training content just in the course of a week, and at the end, I just want to go in and hit a checkbox saying I'm done with it, I can change that down here. So my default is 0 to 100%. I can say complete. If I do that, you notice the box changes to a checkbox over here and it's complete. And that's all it is. In fact, what you're doing is saying that if it's unchecked, it's 0%. If it's checked, it's 100%. That's all there is to it. The other option you have is yes, no. So if you happen to have an activity that is designated as a question, have you completed the training content? Yes or no. So you can just change it to yes or no, and it's exactly the same thing. Yes, checked is 100%. No, unchecked is 0%. So let's go back to our default here, 0 to 100%. And we'll go ahead and save that. And again, you got the notes field down here. This button here puts a time and date stamp on the notes, external partners, and your activity team here. Okay, so that's activity number 1. Let's go back and grab activity number 2 here. Provide the 9 training sessions. Control C. I'm going to add a new activity with the plus button, paste it in here, Control V. In this case, we're going to drop down and call it a QA activity. That automatically opens the wizard here. So here's the different values you can put in here. So how often are we going to repeat this? Again, you got your choice between weekly, annually, biannually, all the way up to 5 years. We know that we're doing this on a monthly basis. So I'll select monthly. We're going to go ahead and set our, by the way, you can type in the date or you can use the little calendar either way. I'm going to go ahead and say March 1 here. I'm going to skip over this timeline for a minute. I'll come back to that in a few minutes here. It's a different type of activity, and I'll show you how that gets used. For now, we're going to go ahead and say, if we get to our 9 training sessions, we're going to let the light turn green. And we pick a number. We just randomly pick 6 as a value. It's not good enough. And you notice it calculates the yellow to between greater than 6 and less than 9, or 7 and 8. Put in a metric type down here. What are we actually measuring? In this case, training sessions provided is what we're measuring. And when I hit this, it creates the performance metric for you. So it's kind of helping you to create it. Training sessions provided, measured monthly, are green, yellow, and red in there. I'll go ahead and save that. Now you'll notice that the traffic light is red now because we have no value in here, which equates to 0, if you will. Once it gets done saving here. Okay, now this is where the traffic light is set automatically. So let's say I've done 7 training sessions. The light turns to yellow over here, as you notice. I go ahead and save that. It'll turn to yellow up there. Now, anytime I enter something in here, it's saying, hey, are you done with this month, basically? Do you want to update the cycle start date? So right now the cycle start date is 3/1/25. Couple choices. I say no, it stays as 3/1/25. If I say current, it puts today's date in there, which is the 21st. I could do that. Or if I say select, which is the most common option in here. So let's say I'm only going to be able to do 7 training sessions this month, so I am done for the month. I'll say select. It'll by default go to the beginning of the next month, 4/1/25. I can overwrite this if I wanted to, so I can type in whatever date I wanted, maybe 4/10 or whatever it happens to be in there. Or maybe we're going to skip over a month because school's out or whatever. So I might put it 5/1. I'm going to go ahead and say OK here. You notice the start date now moves to 4/1/25, and we're moving into a new cycle here. At this point in time, you'd probably want to go ahead and zero this out because you're starting in a new month and we haven't got to that month yet. But you can decide that as you're going forward here. So this is the QA activity. Go ahead and save that again, say no, and we'll just leave it at 4/1. And again, you're going to assign team members and external partners to it. Third activity, the QM activity. Control C, go back over here, hit the plus button, Control V. Contact all 20 tobacco vendors within a mile of Wayne High School. This is a quantitative measurement activity. So I'll hit that. We're going to open up the wizard again. Again, we'll use the same start and end date in here. Okay, my target number, as we know, is 20. So I'll put that in here. Decimal or dollars. Anything you're counting is decimal unless it's dollars. Dollars is exactly that. It's $, couple decimal points. Our metric type in this case is going to be tobacco vendors contacted. Now down here at the bottom, I got a couple of data entry types. The default is enter a value to add to total. So I'll save that. So my performance metric is 20 tobacco vendors contacted between 3/1 and 3/31. When it says enter a value to add to total, let me save this. Enter a value to add to total, I can put in a value that I'm adding into here. It's going to roll up to the total. So let's say this week I did 5. It rolls up to the total, running total of 5, calculates us to be 25% done. So 5 divided by our target of 20 is 25%. So I can go ahead and save that. Is traffic light okay? I'll say, yeah, it's fine. We're on target here. And then maybe the next week I go in and do another 5. And you see it rolls it up to 10, calculates to be 50% done. Save that. Yeah, traffic light's okay. So that's one of the options in there. The other option is, again, this is kind of like I'm doing all of these contacts in a week. At the end of the week, I just want to go in and say I'm done. So I can say enter a total value. I'll save that. So now what it did is move the running total up to here, and I can just put in 20 and it'll calculate to be 100% done, and we're set. So those are kind of the two different options. Again, the default is to do an enter a value to add to total. Now there's one other kind of a hidden option, sort of, and that is, say that. The hidden option is what we call a zero target. So I would go into here, and if I put in a zero target, the target is your denominator in your calculation. So 0, you can't divide by 0, so it takes away the calculation for percent complete. And where you'd use this is if you just want to know, let's say at the end of the month, how many vaccinations did we do? And you're going to have somebody enter that on a weekly basis. Or how many medications do we distribute, or car seats, or whatever you want to count. But you don't have a target number. You just want to know at the end of the month how many you did. You just put in a zero target. Again, it takes away the calculation. You can have either the add to total or just the total value in here and set it up that way. So that is our 3 activities that we believe are going to get us to our target. Go ahead and put the 20 back in here. Save that again. Nope, no duplicate. Okay, now let's go back and look at this plan in the pyramid here. So this is the plan we just entered. The group was Tobacco 2024. Tobacco cessation was our initiative. Reduce smoking in high schools. Reduce smoking at Wayne High School by 25% by the end of the school year. And then the steps we're going to go through to get there. So that is the operational planning process. Again, every plan fits into this model. The nomenclature, as we talked about, may change a little bit here, but that's the plan. Now, what I want to do is show you that variation on the QA activity here. So let's go back and look at that. So this is the plan that we were just talking about. What I'm going to do now is add an activity that has absolutely nothing to do with the tobacco plan, but I want to be able to show you the timeline activity here. So I'm going to hit the plus button here. And this is the one that is used to manage typically critical documents. So I'm going to say update SOP, standard operating procedure 1, update SOP 1 each fiscal year. I'm going to drop this down and call it a QA activity. I'm going to set my frequency because I'm looking at annual here. I'm going to set the start date as the beginning of the fiscal year. So let's go ahead and move it back to, oops, too many years back here, March. July 1st, I'm going to assume is the beginning of the fiscal year. I'm going to select timeline here. Now, this percent to yellow, the light is going to be green normally. And when it says percent to yellow, it says when does the light turn yellow? What percentage of the way through the year? Let's say if I say 90% of the way through the year, you pick anything you want. That would make it about mid-May of 2025 would be the timeline here. And I'm going to say update SOP as my metric type. And when I save that, the metric is update SOP measured annually. It's going to be green as long as we're less than 90% of the way through the year. We get to 90% of the way through the year, the light turns yellow. When the light turns yellow, let me save this. Let's go ahead and pick another lead here. So let's go on down and let's do Stephen. Okay, I'll save that. So now what's going to happen when we get to about mid-May of next year? It says right here that we're 72% of the way through the timeline here. So we're 72% of the way through the fiscal year. When we get to 90% of the way, or about mid-May, Stephen is going to get a notification through the real-time planning. It's going to give him a link that'll take him right back to this activity. Now, this is where you're going to use document management. In this particular case, if I click on here, say add a document, I'm going to go ahead. I just got some random files I'll put into here. I'll call it destruction of records, SOP. So I chose the file. I'm going to upload the file. The file name shows up down here, the file size, and etc. I'm just going to call this SOP1. I can change the traffic light. Let's go ahead and just change it to green. I can put in a note about it, whatever I want to do, and go ahead and save it. So this is the version 1 of this particular SOP. Now I'll go back to my activity. So again, Stephen's going to get that email notification. It's going to take him to this activity. He knows that it's got to be updated. So what he's going to do is click on here. He's going to download that SOP that I just uploaded. He's going to make the new version of it for the next fiscal year. He's going to upload that file to document management. It'll create version 2 of that document. When he comes back to here and he hits the save button, it's going to give him that little dialog that says, do you want to update the start date? You're going to say, yes, select, and it'll update the start date to the beginning of the next fiscal year. The light turns green, you start all over again. So again, where this is typically used is to manage critical documents, and it works great. Let me go ahead and kind of, give you an idea. Let me show you what that kind of looks like down here. So we have a, we don't have it in here. Let me go back to USA Public Health. Okay, so what we did is we created a group called Critical Documents. As we get down to here, we have policies, standard operating procedures, memos of understanding, grant documents. Under policies, we might have manage and update administrative policies, manage and update healthcare policies, as many as you want down there. Under administrative policies, we have update the administrative policies each fiscal year. And then we get down to the actual timeline activities. So we have update the department 24/7 coverage policy. It's a QA activity set to an annual cycle. Same thing, 90%. The light turns yellow. Here's the documents attached to it. You're going to go ahead and drag that document down, do the updates, update the new version, set the light to green, and away you go. The other thing you can do if you decide to use this is at the group level, you can give everybody either edit or view permissions, or You can take away the permissions if you want. But if you give everybody view permissions in the department, then they can go down, they can navigate down under policies and administrative policies, whatever. They can find the policies that way because they're all structured into a nice hierarchical format. So you can go down and you can find that particular policy. You can use the policy for what it's meant to be used for. You cannot update it if you don't have edit access. You can't update it. You can't add new versions. You can't do any of that kind of stuff, but you can use it. Everybody who's meant to be updating those policies will have edit access, so they can go in there and they can actually update those policies like we talked about. So that's kind of the latest, greatest feature that we put in there, and it has become a very, very popular feature here. Now, again, I mentioned that there's homework for this particular section. What I'd like everybody to do is go in and create a simple operational plan. You can be as fun as you want. I've seen planning Christmas parties, planning vacations, planning my honeymoon. Let me kind of give you an idea what it might look like. So you're going to log in, you're going to go to the groups tab. Under the groups tab, you're going to select the training group down towards the bottom there. You're going to select the services and initiatives tab, and then the group will be training. I didn't mean to do it this way. Sorry. Okay, the service initiative, for instance, birthday party for Billy. Billy's my son. And if you wouldn't mind, in parentheses at the end, put in your initials just so we know who did it. My goal, have the best birthday party ever. Smart objective, by the end of January, select an appropriate venue for the party. Activity 1, check with your neighbors for venue suggestions. Activity 2, check Yelp for potential venues. So anything like this that you want to think about, have as much fun as you want, or if you want to do a business-related plan, do that. Put it in the training group. If it's a real plan that you want to use, we can move it from the training group after we're done here. But this way we can go through and review them in our next session here. So this is the homework. The next session, I think we already have scheduled, is basically just going to be a review. We're going to go through everybody's plan, going to review it. We're going to critique it. We're going to make some suggestions on what could have been better, or we're going to say, hey, it's a perfect plan. We don't need to make any changes at all. Any questions?
Thank you so much, Fred. I really appreciate you taking the time this morning.
Oh, my pleasure. Aaron, we do have a section or another plan or section scheduled, don't we?
Yes, we do. It's going to be Tuesday. I want to say it's at 3, but let me double check my calendar here for that really quickly.
Yeah, let me check.
It should be, it's going to be Tuesday at 2.
2 o'clock, right? Gotcha.
Yeah.
Okay. Yeah. So if everybody between now and then could put an operational plan in the system, the nice thing is if you put your plan in there, once we review it, we're going to send you a beautiful certificate to put on your wall. Operational planning is a skill within itself. It's a workforce development skill. It's not really, it is, we use it obviously in the VMSG dashboard, but it's not just for the VMSG dashboard. Being able to create plans like this and be able to execute them, whether you use Excel or anything else to manage the plans, is a skill. So we're going to send you a certificate to prove that you in fact have that skill. Okay, everybody. Well, thank you so much for your time. I hope you all have a great weekend, and we'll plan on seeing you Tuesday afternoon.
Thank you so much.
Thank you.
You're welcome.